What you are looking at is not a medical professional treating malnourished children, but a 19-year-old girl who, without any medical experience, provided drugs through veins, performed blood transfusions, and every critical thing that she was not qualified to do. And then what was feared the most finally happened.
She was not qualified to do this.
They were not licensed as a medical center.
In Uganda, Renee Bach is being sued for allegedly operating a medical facility without a license, leading to the death of hundreds of children.
She claimed that she was contacted by God to help children suffering from hunger in Uganda.
What is feeling called by God? What is that like?
Baby John.
And provide sufficient treatment to restore their health.
Our focus is malnutrition, so we do preventative care programs and then also treatment services.
However, there is a massive difference between spiritual and medical support. Turns out what she has done is a sophisticated form of genocide against Black people.
So many children came to
Yet, despite killing hundreds of children through her unacceptable spiritual belief, Renee openly declares that she has never represented herself as medical support of any type. Surprisingly, after secretly returning to Virginia, United States, she has never been tried in her home country for committing this evil act and was witnessed living a free life with her family.
So, first off, I have never represented myself as a medical professional or health worker of any type.
Now, the biggest question that arises is how she was able to run this unprofessional program for almost 10 years, and how she secretly managed to escape Uganda.
It's kind of like where to begin, you know?
It was 2007, and Renee was on her way to Jinja City, Uganda, a region located in Eastern Africa where people suffering from insufficient food is one of the highest in the world. According to a 2013 report, 20 out of every 100 children under age 5 lack proper diet to live a healthy life. As a result, many are severely underweight, while others can see their bones coming out of their skin, killing 4 out of every 10 children. Fortunately, when Renee landed in this region, she could feel the pain that the children were going through. Although she arrived in Jinja to work at a missionary-run orphanage, after staying for 9 months, she realized that she was born to do more for the Uganda people. In her own words, Renee believed that she had received a message from God in which she was directed to run a charity organization, and this in return could help her restore the health of Uganda's children. So in 2009, she went back to Virginia, where she raised funds through local church circles in Bedford and created her own Christian nonprofit organization called Serving His Children, SHC. Her belief in God's calling grew stronger when she managed to rent a house in the Masisi district of Jinja and used the funds from the organization to provide free meals to neighborhood children. Furthermore, she even drove to the local hospital whenever their health worsened to unacceptable levels. However, in pursuance of these noble activities, something dangerous was building at the back of her mind. A controversial belief that could not only save hundreds of children, but also can take the life of thousands. You see, in one of her statements in 2019, Renee stated that she traveled to Uganda with a white savior mentality, a concept where white people consider themselves as rescuers or liberators of non-white people. But the mindset was pushing her to do more than what she was already doing. In other words, providing meals and taking the children to the hospital was only a tiny part of her true mission. Instead, she was not only imagining herself superior to doctors at local hospitals, but also started to believe that she could treat critically malnourished children on her own. Unfortunately, the roots of this controversial belief became more evident when one of the nurses from a local hospital called Nalafunya asked for Renee's help in treating malnourished children. This was the moment when she considered this as a perfect sign from God, and soon she turned her rented place into a nutrition center. A place where she not only installed better medical equipment than hospitals, but also hired several Ugandan nurses to support her in this mission. Now, Renee's objective was clear. She would use this center to treat children suffering from severe hunger crises and restore their health while their parents stayed at the center to keep a check on their children. However, none of the parents knew that she would be responsible for killing not one, but hundreds of kids. In her blog post, dated July 2010, she said, "Tomorrow I am picking up 4 more children from the hospital. Pray for the children's recovery." But check this out. The moment she brought the kids to her facility, their parents were handed over a volunteer form that said, "You don't have to be a licensed teacher to work or be in the medical field to put on Band-Aids." Throughout this statement, Renee asked mothers to learn medical skills at her facility so that they can also treat their children on their own. However, Renee did not declare that she had neither hired a doctor nor obtained a health license to run this center. Although this initiative attracted hundreds of Ugandan families, whenever an opportunity arrived to make the critical decision, it was Renee and not the nurses who had the final say. Even if nurses passed orders without Renee's consent, she would quickly override their decisions by stating that she has more knowledge than Ugandan doctors, as she has access to online resources. Nevertheless, the real truth could not be hidden for long. When a mother named Namuntamba brought her child, Twalali, to serving her children, she was received by Renee, who was dressed in a clinical coat and wearing a stethoscope around her neck. Namuntamba called her Aunt Renee after realizing what she was doing for the Ugandan families. A few moments later, she saw Renee inject something into a Twalali's head and some tubes and wires from the baby to the machine. After desperately waiting for days, one day she saw Renee come downstairs holding her baby wrapped in white cloths. But this time, the baby was not breathing. When Namuntamba later realizes Renee is not a doctor, she decides to file a case against her, claiming Renee presented herself as a medical person. Even the chairman of her village thought Renee was a doctor. I want Renee to face justice so that another mother doesn't have to face a heartbreaking situation like this again.
Mwene yavuye n'omulambo gwe ng'aguzinze mu ngoye omuzungu yaguta mu motoka yaguta ku ntebe ng'aguzinze nga ndi mu Dawudi tidiniye musibe waaku ene inuma neika nembe.
However, before this case could arrive at an acceptable solution, it was too late. A Ugandan driver who worked at SHC said, "For 8 years I would drive at least 7 to 10 bodies of children back to their villages each week." Astonishingly, according to a report claimed by Renee, 119 children died at their center out of 3,596 patients they have dealt with, which was lower than the average 20 to 30% death rate of malnutritioned children in the country. But the picture became clearer when Jacqueline Cramlich, an American medical practitioner, volunteered at SHC. At first, she felt proud of Renee for taking such a remarkable initiative on her own. But when Jacqueline reached Uganda, she could not believe what she was witnessing.
This was over my head.
Jacqueline saw Renee conduct critical procedures that are extremely dangerous without oversight from a doctor. Specifically speaking, she saw Renee performing blood transfusions, taking blood, inserting intravenous catheters, giving injections, and even prescribing drugs for various medications. Fortunately, she also discovered that the reason for the high death rate was that Renee gave excessive amounts of intravenous fluids to children at critical stages. Now, these fluids are given to treat dehydration, but as Renee was exercising authority and was also not aware at what level it should be given, the death rate remained high every week. When Jacqueline asked Renee on what basis she gave such treatments, she was baffled to hear when Renee replied that she followed her gut feeling and believed that God would tell her what to do for the child.
Do you think Renee's a murderer? I would not. Oh God, that's a good question.
The situation became more controversial when Renee told Jacqueline that she heavily relies on the book called Where There Is No Doctor, a leading book on providing healthcare in villages where there is lack of qualified physicians. However, in 2010, the Journal of the American Medical Association openly stated that it is still not known that this book improves health. Meanwhile, the British Medical Journal stated the book cannot be relied upon for healthcare information. Yet Renee followed every step of the book and followed her gut feeling that no professional doctor would recommend. Fortunately, since 2015, when families started raising complaints against her activities, she stepped down as director of SHC in 2019 and returned to the US. Now check this out. Before leaving for the US in 2019, Renee ensured to SHC staff that she would soon come back after raising some money for the NGO. But in reality, she left in response to a lawsuit that was filed by two mothers against her in the High Court of Uganda. As a result, she dissolved SHC and paid $9,500 to each mother for irresponsibly taking the lives of their children. But the actual question that remains is, what about hundreds of children that could have been saved if she had avoided her gut feeling? Can money bring those children back? Or what would Renee do with her daughter if she were in the same situation as Uganda? So what are your views about Renee Bach misusing the laws of medical support? Do you think she did this intentionally? Tell us in the comments section below. Don't forget to subscribe to our channel and press the like button if you like this video. Thank you so much for watching.